Annual enrollment period for Medicare health plans is just a few short weeks away, and it's important to understand that regardless of your Medicare health plan, some due diligence is required every year. Hi, I'm Stephen Crawford with Clarity Wealth for this week's Friday Fireside Chat. I want to take just a few minutes talking about the annual due diligence or annual maintenance that's required when you're on a Medicare health plan. And those come in a couple different ways. During annual enrollment period that runs from October 15th through December 7th every year, on a Medicare health plan, you have the option to change plans or modify coverage. Let's start out with the due diligence that's required when you have original Medicare, Medigap or a supplement, plus Part D prescription drug coverage. In that scenario, the one thing that you absolutely have to shop every year is that prescription drug plan coverage or Part D coverage. This is coverage that's provided by a private health insurance company, and so you'll want to make sure that the plan you are on has the lowest cost and the most coverage of the prescriptions that you have. It may be that prescriptions have changed, or there's another vendor out there that provides a lower overall annual cost to you once you weigh in monthly premium, drug coverage deductibles, and then the cost of the drug that their plan provides. So you want to shop those, make sure you're getting the best deal. Next, I want to talk about if you're on a Medicare Advantage plan. Most of the Medicare Advantage plans also include the Part D prescription drug plan coverage. So if you're on what's called a MAPD, that's Medicare Advantage with prescription drug coverage plan, you'll want to shop those plans every year. These are typically one-year contracts with a private insurance company, and each of the insurance companies try to capture as many new beneficiaries as they can, and as a result, they will offer more incentives to come onto their plan. So each year you need to go, hey, this is the MAPD I have, but is there another MAPD out there that could better suit your needs? Could be from a coverage standpoint, could be from benefits that it provide, or could be overall cost out of pocket to you. It's important to make sure that you look at your Part D prescription drug plan every year if you're on original Medicare with a supplement and that Part D, or if you're on a Medicare Advantage plan with the Part D coverage. Doing this due diligence every year will ensure you have the right Medicare health plan for you at the best cost with the right coverage. At Clarity Wealth, we help our clients with that. Just give us a call. We'll help you get through all of this information and the due diligence to make sure that you have the best plan available for you. And if you haven't worked with our team, feel free to reach out. We look forward to speaking with you. If this video has been helpful for you, please be sure and like and subscribe. We want to get as much good information out to as many people as we can, and we appreciate the help. Have a good one.